Hey everybody, I am Jay Blastig Cabrera and I'm with the Stop Coronavirus Global Campaign. Today I'm doing a shorter video. I got requests to do a shorter video focusing on covering your nose and your mouth and the science behind why everybody should cover their nose and their mouth. I've thrown out the hashtag CYMan, CyMan, cover your mouth and nose. And there's also hashtag masks for all, although across the world, everyone won't be able to have a mask. So the key is to cover your nose or mouth, and we'll go over all the models for how you can do that. So we're going to cover the why of needing to cover your nose and your mouth, and we're going to go over the articles, and then we're going to go over the how to do it. So let's just jump into the why, starting with the current status of the global outbreak, which is not good to say the least. Basically, what we have here is nothing, huh? Jeez. There we go. You can see it now. So we're March 31st, and you can see how it's gone from pretty much not much going around about, this is March 8th. So from March 2nd to March 31st, basically we went to a little bit in Italy, a little bit in Iran, to basically Europe being taken over by mid-March, and then the United States getting taken over. And you can see South America is next. Australia's not doing too good. So this is the current status of the outbreak. What the most important parts is that China does not have cases because they are using the suppression model. I also am working with an additional name for the suppression model, which is basically understanding that it is preventing and stopping the exponential growth and actually doing exponential decline while stopping the virus. So the method of the suppression method itself can get a little bit different perspectives on that. So South Korea is doing really good. They're staying low. And other parts of Asia just in general have a much better outcome here with the virus. I think one of the reasons for that is because they have an easier cultural ability to have their mouths and nose covered because it's just more accepted there. The bottom line is that we're in a global pandemic. In a global pandemic with a virus that is spread through aerosol and microdroplets, you need to cover your mouth and your nose. It's just what you do in a global pandemic that spreads from microdroplets. So let's go into more details on our why here in the science. So we know that the science shows that the droplets are projectiles, and they go from your mouth when you're talking, out of your mouth, and there are micro droplets that are much smaller, almost like vapor, and they hold enough virus to pass it along. I mean, that's basically the science. So yes, with flu and other types of viruses, you get bigger droplets, and when you have bigger droplets, you end up with a spread from sneezing and coughing. But in this case, we basically have micro droplets, which are much, much smaller. And we'll go through some of the articles here. I think this first one's a pretty good, has some good pictures. And these micro droplets can, basically I think the good term is aerosol. So they are in aerosol form within the air, even though they are droplets and they do fall down eventually. The best way to think about it is that until we have science that proves that there is no aerosol and there's no microdroplets in the spread of the virus, we need to be covering our mouths and our noses to protect ourselves and our communities from the spread of the virus. It is by far one of the best ways of doing it. Also, in terms of the overall suppression model and the various steps that could be taken, of the three most important steps, which is stop travel, testing, tracing, and isolation, right? So basically you have stopping travel, and then you have testing, tracing, isolation. Testing isn't much good without also tracing, tracking, and isolating the people who test positive. Because if you just test and then you have people walking around in the public and spreading the virus even though they tested positive, or going home to their families and spreading it to their families, doesn't do much good if you're not also tracing, tracking, and isolating the people who test positive. Stopping travel, everyone should stay home, but if the governments aren't, doing roadblocks and actually preventing travel, it can be difficult to do that. So of the three, the covering nose and mouth and doing temperature checks at basically all business fronts and anywhere where people are going to be, interacting in public closer than 6 feet or so, or 2 meters, it is really important to have, you're covering your nose, your mouth. So this is by far the easiest of all of the options that has the biggest impact, where people can take it into their own hands, their own power to implement this without the need of governments or, top-down implementation. We can do this ourselves. So let's go some more into the science. In terms of the aerosol and other understanding the context of the spread of the virus, right? There are some pretty cool diagrams in some of these. Let's see if I can find one of these diagrams. In terms of should everyone be wearing a mask? The answer is yes, that's for sure. And you can see, more and more experts, and including the director of Chinese Center of Disease Control, think that it is a huge mistake for people in the United States, and in Europe they're starting to wake up to this, to not be covering their nose and their mouth with something. I mean, it's really, really a big mistake, because the science is showing that there's no proof that the virus doesn't basically spread from people just talking and breathing. So in terms of getting the mechanics and understanding how it works, right, in the aerosol form, right, there's large droplets that fall quickly, right? There's also, when you cough and sneeze, they can go long distances, greater than 6 meters, right? But overall, you have all these smaller little aerosol droplets that can, in essence, I wouldn't say float, but they hover a little bit longer in the air and are easier to be passed on. And the science is basically showing that the virus can withstand the smaller micro droplets in aerosol form. So this gives a good overview of what the science is saying, and we'll go into more details there. The other science that's super duper duper important to understand is so microdroplets, aerosol, breathing, and talking all can allow the virus to spread very, very quickly, because we obviously see that just washing your hands and coughing into your arm isn't enough. It's still spreading. So the other very important science, that 50% of all cases have no symptoms. So if 50% of all cases have no symptoms, then you don't even know you have the virus. And so if half of everybody who has the virus doesn't even know they have it because they have no symptoms, and they don't go for testing, there's just no way for them to know. So when they go to a grocery store, when they go out in public, they're just going to be spreading the virus to everyone. There's also some data that shows that people who don't have symptoms still are able to spread the virus quite easily, which you obviously see in the massive exponential increase in the virus. So there's a reason why you have this increase, exponential growth, and it's because the normal procedures of washing your hands and coughing into your shoulder or whatever aren't working. It's just not enough, and so you're still getting massive exponential spread. So in Iceland, they did massive testing. It's one of the only countries that's testing everybody, and they are showing that 50% of cases are asymptomatic. So that is very, very important science for why everybody, not just some people, need to be covering their nose and their mouth. There's really no other logical explanation for not doing it. Some say that some of the countries are saying not to do it because they not cover your nose and your mouth because they're trying to save protective equipment for the medical field. And so, that's might be good and all, but it's not science, right? So the direction that some of the places are going, which we'll cover more later, is that it's looking like that there would be guidance on basically using cloth and towels and things to cover your nose and your mouth, as opposed to other methods of doing so, like using masks that are necessary for medical staff. So the most important thing to understand in terms of the medical staff, we can talk a little bit more about the United States here, but it's applicable anywhere in the world. So the medical staff need masks, ideally N95 masks. So for N95 masks means that 95% of all particulates are filtered out. I believe it says 0.3 microns, like water droplets that are 0.3 microns or more. Right, so N95 masks are extremely important, and they are needed in medical facilities because the doctors and nurses need to be able to treat patients who have a lot of the virus, and so therefore we want to protect our medical staff, right? But one of the problems with the current media coverage in the United States and other places across the world is the term, front lines in relationship to medical staff. Like, it's true the medical staff are part of this war, right, against this virus, but at the same time, they are not necessarily the only people who are near the front lines. In fact, I actually use the term triage. Basically, you have the wounded and the injured and the casualties. So the medical staff is basically what I would call the triage, which is right behind the front lines, whereas the front lines themselves has to and does include all of the businesses across the world who are open for business, including grocery stores. You obviously have pharmacies, delivery drivers, and all the support supply chain for those businesses, right? So, and then there's also, medical and fire and other police, right? All of those are on the front lines as well, and they need to be protected. So the easiest way to think about this, and this is where this other article came here, is that Amazon workers, Instacart workers, people are striking because they're not getting the protections that the workers need to be taken care of, right? So the bottom line when it comes to medical staff is that if a doctor who's working with the patient gets the disease themselves, right, and they get the virus, there's not really a lot of people they can spread it to. If they went home, they might be able to spread it to their family, which is bad, and that we don't want that. But as far as working with the public, all of the clients that they're seeing, all of the patients the doctors are seeing, all have the virus already, right? So it's not possible for them to spread it to lots more people. If a grocery store clerk gets the virus, right, they might see 1,000 customers in 1 week and could spread it to all of them, right? And that's why someone like a grocery store checkout clerk is on the front lines, because they are on the front lines of the spread of the virus, whereas in a medical facility or a hospital, there's just no one to spread it to because all the patients already have the virus, right? So it's not actually the battle to stop the spread, it's just the battle to save lives within the casualties and the wounded from the front lines of the battle. So in the perspective that I see it, the within the hospitals, it's more of like a triage center. It's the dealing with the wounded, the injured, and there are a few components of medical and health that do involve front lines. One is the waiting rooms of the emergency hospitals, right? So any waiting room needs to be looked at as a front line. We need to get everybody wearing nose and you should basically not be able to enter a facility if your nose and your mouth aren't covered in relationship to a waiting room, because there's so many people that have the virus there. And then, one recommendation would be just to put your waiting room outside. If you are packing people and they can't be at least 6 feet apart in your waiting room for your hospital, they need to be waiting outside and be further apart. Or you need to have much larger amounts of ventilation within your waiting room. But if it's a stuffy, small waiting room, the emergency waiting room should be outside. You just move it outside and give people numbers and call their number when they're ready to come in, because we need to stop the spread of the virus at the front lines, and one of the components of the front lines would be the waiting room. Once the people go back into the back and go into the triage and are part of the patients with the virus, it's no longer the front lines, it's triage, right? From that point of view, all doctors who are at clinics should be seeing patients online, and that obviously any clinic or any place where they're not directly working only with coronavirus patients would also be considered front lines. So the bottom line here is that we need to be protecting and supporting all workers on the front lines, not just medical staff. Like, we have to support and protect our medical staff, of course, right? But to allow Amazon workers to get sick, to allow, Instacart workers to get sick, to allow our grocery store to get sick, and not give them the same level of importance and protection as medical staff is not fair, and it's not okay. We have to be protecting all frontline workers, not just focused on the one that has the most media coverage, for example, the medical staff. So yes, we want to support and protect the medical staff primarily with N95 masks. We also want to support and protect all other grocery store clerks, businesses, pharmacies, delivery drivers, everybody who is working on the front lines, to protect them from getting the virus with some type of covering the nose and the mouth. It doesn't have to be a mask, but if you're a business, you want to protect your workers and employees because they are so important for the business as assets for the business to be successful. If your workers get sick and get the virus because you're not protecting them, then your business is going to be hurt from that. So it's just bad. So it should be in the best interest of all the businesses, the owners, the workers, the store managers, everybody's best interest to protect all workers on the front lines, including grocery stores, including pharmacies, including delivery drivers, including the entire supply chain. And the best way, easiest way to do that is for everyone to be covering their mouth and their nose, right? Simon, and just make sure that everybody is, not just one or two people. So we're going to go over some more of the science of why it's so important to have everybody do it as opposed to just some people. So why everyone? So I think the best article for this would be going back to here. All right, so the data here, which you can see, basically if you have all these particulates in the air and floating around and projectiles and all that kind of stuff, the small ones are obviously bigger and are blocked best by an N95 mask, but even just a normal surgical mask or towels or cloths that you make at home do significant amounts of blocking. So here you have your homemade cloth and you have your normal surgical mask, and then you got your N95. So again, N95s for medical staff. For other workers, the homemade or the surgical masks are perfectly fine. All right. So, and we'll show you why it works, right? And the key thing here is the difference between breathing and coughing and sneezing, okay? So when you breathe, a normal homemade cloth will stop 1/3, right? 33 out of 100 particles, right? A surgical mask will stop 1/4, right? It'll stop 75 out of 100 particles. The homemade cloth will be, it'll stop 66 out of 100. Surgical mask, 75 out of 100. And then N95, you're stopping basically 95 out of 100, or getting close to 99%, right? So that is for just general breathing, right? We're going to talk more about this later, but when you're doing coughing, right, this is specifically in relation to the coughing, the amount of particles leaked and the amount of particles blocked are much, much, much less. And the reason's obvious. If you have a mask right here and you cough or sneeze, when you're breathing, it's just like very small amounts of air coming in and out, right? But when you cough, you get a large amount of air coming out and the volume is much greater very quickly, and the mask just can't hold it. So we're going to talk about that more in a bit. But let's just go over this. So the most important reason why everyone needs to do that if you're breathing, right? So breathing and normal talking, the science says that a normal cloth would be equal to 66 out of 100 particles blocked, right? Which is equal to 1/3 allowed through, right? So this is what we call a 3x, or three times reduction, right? From there, you've got a surgical mask. Surgical mask is going to be 75 at 100 particles blocked, which is equal to 1/4 allowed through, which is equal to a 4 times reduction, okay? All right, so particles blocked. All right, so the most important thing to understand here is that there's a two-way street, right? So there's people who are blocking the inward particles to stop getting virus, and then there's people who are blocking the outward particles to stop sending the virus out, right? So stop getting the virus in and stop the virus coming out, right? So again, people who have the virus, 50% of them don't know they have it. So the people who are trying to block the virus from getting out while they're talking and breathing don't know they have the virus, right? So therefore, everybody needs to be covering their nose and their mouth so that just in case they have the virus, they're blocking it, right? The other people who don't have the virus also are wearing their mouth and nose because it's so essential, right? So let's say you walk into a grocery store, right? And you are wearing, you decide to wear cover your nose and your mouth, right? So we're just gonna, average it out and say it's about 3.5x. So somewhere between, some people are wearing their cloth, some people might be wearing surgical masks, whatever. It's about 3.5 times reduction in particles getting into your lungs, right? So a 3.5 times x reduction would end up being about, what was that? So it was like a 75. So it's like an N70. So instead of an N95 mask, it's like an N70 mask, right? Which is low, right? It's kind of like they say, the science shows that if you're just wearing a mask, it's not necessarily going to protect you from getting the virus. It's an N70. It's not really going to reduce all of the particles, but it will reduce it about 3.5 times, right? So if you're the only person wearing a mask in a grocery store, that's how much protection you have. 3.5x reduction of the amount of particles that get into your lungs, and it's about the equivalent to an N70 mask. So if no one else is wearing a mask or covering their mouth and their nose, you may want to consider wearing an N95 mask if you have it, right? But anyways, that's just that particular situation. What we're trying to do is to get everyone to cover their nose and their mouth with something. As soon as you do that, the numbers are incredible, because then you have 3.5x times reduction in particles getting out from others' lungs, right? So if you're wearing a mask and then they are also wearing a mask and everybody is wearing a mask, not only are you reducing the amount of particles coming into your lungs by 3.5 times, the amount of particles going out of everyone else's lungs is reduced by 3.5x. So the total amount of particles in the air are already reduced, and then you're taking a reduction of those particles, right? So what happens is you get a multiplication. So you do 3.5x times 3.5x, which is going to equal almost 10x, right? So let's see what we got here. 3.5 times 3.5 gets us to 12.25x. 12.25x. So this is where the science comes in and shows how important it is for everyone to be wearing something to cover their nose and their mouth, right? What was it? Hashtag SciMan, baby. SciMan. Cover your mouth and nose, please, right? So when everybody covers their mouth and nose, you end up with, if it's 3x, it would be about a 9, let's just say 10, 9 to 10. Well, actually, let's go, before I go into the details, I want to say one other thing, which is that when everyone's covering their mouth and their nose, not only are you stopping the particles that are out in the air, also all the droplets are cut in significant ways, right? So the droplets also are reduced. significantly. In fact, even more, right? It's better at reducing droplets because they're bigger than the small little aerosol particles. So what's so important about the droplets is that you no longer have droplets going all over the food and products in your store, right? So this would be applicable to food and people who are cooks and cooking the food, right? And it's also applicable to grocery stores. It's like right now everyone's scared to go shopping and get deliveries and go to get takeout because their food could potentially be contaminated if any one of those workers has the virus, right? So a lot of people, when they bring their groceries home from the grocery store, they disinfect and spray it and disinfect it because there could be droplets all over the groceries, right? So when everybody's wearing something over their nose and their mouth and covering their nose and their mouth, it not only reduces the particulars in the air, the temporary micro droplets in the air, it also even more so reduces the droplets that fall on all the products and the groceries and everywhere, right? So then all of our products are more sanitary. Our food is more sanitary. The produce is more sanitary. We don't have to worry as much about spraying it all down and washing it and sanitizing it over and over and over again because the amount of reduction in the contamination of everything in the entire supply chain is completely reduced by, like, as we go here, 10 to 20 times. So when you look at this averaging, so the average is about 3.5x, which is about 12.25, 12 to 13x reduction. So with a normal cloth homemade mask, right? So basically your homemade covering your nose and your mouth with anything, you're going to get a 3 times reduction, right? This is about 9 to 10x, right? Because we're also getting a lot of benefits by not having droplets fall everywhere. So it's more than just the reduction in the particulates. You're also getting a reduction in everything else by touching things and then touching your mouth and nose. All of that will be reduced. The other one is like an actual surgical mask, which is a 4x, which would be 16 times reduction, right? So if you extrapolate that, a 16 times reduction with surgical masks, plus you bring in all of the droplet reduction and the sanitization of all of the supply chain, because all workers in the supply chain are all covering their nose and their mouth, including delivery workers, people who are delivering the food, people who are making food, everything, right? So you're getting this massive reduction. So overall, we can estimate that there's a 20x reduction with surgical masks, right? So the general framework here is a 10x to 20x reduction in transmission by everybody wearing a mask. So again, if you're the only one who's wearing covering your nose, your mouth, or wearing a mask, you're only getting a 3 to 4 times reduction in transmission, right? Which isn't that helpful. But when you have a 10 to 20 times reduction because everybody is wearing a mask, that's huge. It is very, very significant, and it's equal to a 10x would be equal to a N90 mask, right? And a 20x would be equal to an N95 mask, right? So basically, by everyone covering your nose, your mouth with any simple cloth related whatever, you're basically getting to an N90 mask. It's equivalent to your grocery store being an N95 mask everywhere, which means that very, very few of the particles are getting through. It's almost to medical grade. And then if everybody had a surgical mask, it would be basically equivalent of you by yourself wearing an N95 mask, right? So I don't know how to emphasize this enough, but the science is saying that if everybody wears and covers their nose or mouth with something, the spread of the virus will be reduced significantly in all public places. This is exactly what they do in China, in South Korea, in Asian countries, in Hong Kong, Taiwan, Singapore, all these countries that successfully prevented the spread of the virus going up exponentially, or that they were able to suppress and stop the spread of the virus entirely. Everybody in those cultures wore masks of some sort, or they did DIY masks, covering their nose or mouth. We'll go over some of the how and the different options that we can from there. So I think we covered the science at this point. There certainly could be more studies done on this, but until there are studies that specifically say that wearing masks don't help, right? There is no study, zero, that says that it doesn't help, and there are many that say that it does help. So, in that context, we have to be going on the side of worst case scenario, that we need to be protecting ourselves. And something like this is very simple, where we can have all we can be. Well, we'll go over the how to do it soon. All right. So a lot of the governments are giving information based on, that it's only medical workers that need to worry about this, but really it's a supply chain issue, that they don't have as many masks, and they're just trying to make sure there's not hoarding of them, so that the medical workers have access to it. But whether you're talking about a medical location or anywhere else, it's just the bottom line is that every business, every public location where people are interacting, where they're closer than 6 feet apart or 2 meters, needs to have a instituted policy or a culture where everybody knows they need to be covering their nose and their mouth. And it's basically a pandemic, right? Where we have aerosol transmission of a virus. This is just a no-brainer. It's just, you do it. That's what you do during a pandemic. You don't go out to grocery stores without covering your nose or your mouth, because you're putting everybody at risk. Everybody. You're putting your family at risk, your friends at risk, your community members at risk. But to cover your nose and your mouth, little Simon action, you're protecting yourself and your community, and helping the virus go away, and getting our economy back and working, getting people back to work, making sure that the workforce is protected, right? That all frontline workers, including medical staff, including grocery store clerks, including all of the people who are delivering the food, and making sure the supply chain is supported, everybody wearing and covering their nose and their mouth will protect all of us, because everybody deserves to feel like they're going to a workplace that is safe, right? So where does this need to happen? It needs to happen at all businesses. It needs to happen at all public locations. It needs to happen at grocery stores, pharmacies, anywhere where there's sidewalks or people are crossing next to each other. Certainly anywhere where people are walking behind each other, because basically they're breathing and behind them is a wake of droplets and micro droplets. So if you're walking behind somebody, you definitely need to be wearing, covering your nose and your mouth. So, everybody needs to be doing it, and you need to do it with anything, and we're going to cover that next. So before we go over the hows, and we're going to show you some home versions of using paper towels and things like that, and there's plenty. You can just Google how to make my home mask, with my sewing machine, or even just tying it around like a bandana. They have many, many ways. You can easily Google that. We're going to go over basic tissue paper towel. But before we do that, let's go over some of these other articles. So we covered the first two already. Let's look at this one. And this one here. So basically, the Chinese top scientists are saying that it's a big, big mistake not to be covering your nose and your mouth, right? Obviously, it would be ideal if everyone had masks, but any sort of way you cover your nose or your mouth is more than good enough based on the science. And where they were successful in stopping the virus and preventing millions of people from dying, they covered their nose or mouth. So let's just do it, right? The science is showing that it can and is helpful in preventing the spread of the virus. That's really what this article is saying. And so there really isn't much to say here. Like, we all just need to, we'll go over the how, but we all need to take it into our own responsibility to save lives. It's up to us to save lives, not waiting for the government or waiting for some other authority figure to save lives for us. We are the people, we are our own best interest, and we need to step up and follow the scientists. And until there's science that shows that this is definitely not an aerosol virus, right, then we need to be following the science that covering your nose and your mouth is the best way to prevent the virus from spreading. Everybody has to do it, not just one person, not just 10% of people, not just 50% of people, 100% of everybody who goes inside a grocery store. Right? And we'll cover some of the hows on how best to do that for your business and how to help get businesses to do it. Right? So those are pretty much the articles. Some of these other articles which are interesting are showing how bad the situation is. We already went over, is it this one? Yes, Amazon Instacart workers are striking. They do not feel protected, right? Amazon needs to protect its workers. Every single worker who goes into an Amazon warehouse needs to have their mouth and their nose covered just in case they have the virus so they don't spread it to all their employees. It's easier to get it from your employees than it is to get it from the public, well, especially when you're in a warehouse, right? So when you're not protecting your workers, right, and ideally they would be doing temperature checks as well for all workers, you have a big problem, especially if our supply chains could, if no one wants to work, our supply chains can start collapsing and get worse, which would be bad, very, very bad. So there's one last article here. It doesn't look like it's coming up. So that is what it is, but I can at least talk about it. Sometimes it comes up here if you click on it once. No, well, that's why it's not coming up. So this last article was an article in regards to Walmart, and Walmart is the first big corporation that is actually using the suppression model for their employees. So this is very, very exciting to see businesses coming around. And they're going to it's going to take 3 weeks though, which is ridiculous. They should be able to do it tomorrow, but they just need to test all of their employees for their temperature when they come to work and make sure they're covering their nose and their mouth. It's really that simple, and all businesses should do it and can do it, right? So it doesn't look like we're going to be able to see that article, but that's okay. So when we come down to the bottom line of how and implementing this inside businesses themselves, we can see how it's starting, and it's slowly starting, but it needs to be more than just the employees, right? The way you protect your employees, like at a Walmart, for example, is not just having your employees wear protection on their nose and their mouth and covering their nose and their mouth, Simon. You also need to have everybody entering the store covering their nose and their mouth, right? Because when every single person of the public and the customers are covered their nose and their mouth, that's protecting your employees so that they don't get sick. And again, when everyone does it, the total protection is 10 to 20 times that of not covering your nose or mouth. Whereas if only your employees are doing it, they're only getting basically 3 to 4 times protections, right? We want the 10 to 20 time protection, which will actually stop the virus as opposed to still allowing it to spread. You want to make sure every person walking into Walmart, ideally you'd be having someone at the front door doing the temperature checks and the making sure they're covering their nose and their mouth. Every single customer, every single worker and employee, everybody. So let's just note that down. The best case scenario is you basically do temp checks at the door with all people entering, including customers and employees, covering their nose and mouth, okay? So again, you can use whatever you want, but that's the best case scenario, and that's how a business would do it. They would just implement a simple policy that anyone who goes inside that building needs to be covering their nose and their mouth and has a temperature check. If you're not going to do the temperature check, you definitely want to do the nose and the mouth covering, because then otherwise you would just be letting people with the virus come in and just breathe, cough, sneeze all over everything. Not good, all right? So let's go over some of this. There actually is one more point of the science we're going to cover here real quick in terms of the how. So how do you keep at the 10x to 20x reductions? And there's 2 things you need to remember. One, obviously, cover your nose, your mouth, and having everybody do it, not just some person. Even if one single person in the store is not covering their nose and their mouth, your reduction goes from 10 to 20x reductions all the way down to 3x, right? you just lose so much power by having a single person. If that single person is the one who happens to have the virus, everybody is at risk, right? So by ensuring that 100% every single person in that building is covering their nose and their mouth, you're keeping your reductions and your protections 10 to 20x, which again is about an equivalent of an N90 to N95 mask. Okay, so it's medical level science. You need to review the science and check it out, but I've done the numbers. It looks correct to me. The studies look good. But there's another thing, right? So the 100% of everyone. So everyone is key. The other thing that is key is sneezing and coughing. Okay? So everyone, all customers and employees. So coughing and sneezing. As you know, the mask is okay for breathing and talking, right? Because breathing and talking is just small amounts of air volume, right? But when you cough or sneeze, you're doing a lot of air all at once, and the mask can't hold it, and so boom, all this particulates come out, right? Bad. So to keep the 10 to 20% reductions, right? If people are coughing and sneezing in your store, instead of going down to 3x, you're literally going down all the way to like 1 or 2x, right? You coughing and sneezing is like the worst thing that can happen in terms of protecting the general population. So there's a bunch of things that you can do to mitigate the coughing and sneezing. Right, the first one is, basically put out a sign. Hey, everyone entering the building, even if you don't have a checkpoint, you can have everyone entering this building needs to cover their nose and their mouth. Right, so just put out a sign, and you can add in, small print at the bottom of the sign that, please cough or sneeze outside. Right, so usually when I cough or sneeze, I get that feeling in the back of my throat, I get that feeling in my nose, and I can hold it for 5 to 10 seconds and just put down my cart or my basket, walk outside quickly, and cough and sneeze outside, right? So it's not that hard. People can try to do that, right? I would say that a lot of the coughing and sneezing in a grocery store can be avoided simply by people just when you need to cough and sneeze to go outside, right? If you can't prevent yourself from coughing and sneezing for, a half an hour while you're in the grocery store and you can't, leave, and you're going to be in coughing and sneezing the whole time, you probably shouldn't be in the grocery store. We are in the middle of a global pandemic where potentially millions, if not hundreds of millions of people could die, tens of millions of people could die if we don't do this, right? So it's everybody's needs to work together in this, right? If you can't go grocery shopping without coughing and sneezing, just ask someone else to do it for you, right? It's not that hard. And they should be happy to do that. If you think you can go grocery shopping without coughing and sneezing, but then you need to cough and sneeze while you're there, usually it's just 1 or 2 coughs or sneezes, right? Try to get outside, right? That's the second part, right? So 1, don't go shopping if you have to cough and sneeze. Ask someone to go for you, right? So usually if you're coughing and sneezing all the time, you're sick or you have, chronic cough or chronic sneeze that you just can't avoid, in which case, because we're in a pandemic, that's a small amount of the population, ask someone to shop for you. The second part is that you need to just go outside, right? So hold, cough, or sneeze, and go outside, okay? If you can't go outside because it's just an immediate cough or immediate sneeze and there's nothing you can do, the last thing you can do, right, and this is based on the science, the reason why the mask doesn't actually hold in the cough or the sneeze is because it's so small, right? The mask is only this much air, and when you cough or sneeze, you're getting a big volume of air, right? So the easiest, quickest way to limit a large volume of air, right, when you cough or sneeze, is not your elbow or arm. When you cough or sneeze in your elbow or arm, it just goes out. I mean, there's less than a mask. A mask at least has this much. An elbow or arm, there's no blocking at all, right? So you're just going out into the public air, right? So the best way to cough or sneeze when you can't get outside, and even if you do get outside, is to cough or sneeze into your shirt, right? So if you go into your shirt, you cough or sneeze in your shirt downward, right? Or your jacket or whatever, it's a much larger volume, so it's more like this as opposed to the mask, right? So you keep your mask on, you go into your shirt, you cough or you sneeze in your shirt. Even if you go outside, it's good to do this outside with your mask on, and it should hold a bigger volume so that as it emanates out your shirt and comes out, it will not spread out into the air to people around you. So again, last case scenario, worst case scenario, to try to prevent coughing and sneezing indoors, and you can't prevent it, you're going to cough or sneeze into a large volume area like your shirt. Other options could be a grocery bag, right? So if you were carrying a grocery bag with you, you could cough or sneeze into the grocery bag, a purse, or other, basically anything that has a larger volume that can block the trajectory of the cough and the sneeze out into the air. So I think that's pretty much all I need to say about that. If you allow coughing and sneezing to kick on, your 10 to 20% reductions goes way down to only like 1 to 3x reductions. And it's really not that hard to just ask people to go outside for coughing and sneezing, or minimally to do it into their shirt or their jacket or a bag to keep the volume going away from out into the air, into the public air. Okay, so you're keeping it on yourself and in your own area. So that's super important. So let's go into some of the simple DIY things. There's a lot of options. One option, of course, if you don't have a mask, is you can just make your own. And there's a lot of DIY mask options on the internet you can look up. But there's a couple things even simpler. One is a simple paper towel. This is a half paper towel, so you used to be a full square, but now it's a half square, right? Perfectly fine. There's really no problem with using a paper towel. So you put it over your mouth, and I have a hat on, so I'm just going to cheat right now and stick it into my hat. And my hat kind of hold it on for a second. Of course, it's not going to work, but it did before. There we go. So I'm just tucking it into my hat. Although you don't need to do that. Okay, there we go. And then you take your rubber band and you bring it over and get it on your nose. There's one side of my mask. You can bring it lower on your nose as well too, if you want to bring it lower. And then you can bring the second rubber band down to the bottom on your chin or on your neck. It's not pretty, it's certainly not perfect, but you know what? It's good enough. And a lot of the places that depend, some of these links have some information about mask making. You can just Google it. But some places are saying that paper towels are actually potentially better than just doing a cloth and like cotton and stuff like that. So some people even do a cloth on the top and then on the back and then put the paper towel in between, right? So this is the paper towel. It works perfectly fine with just a rubber band pretty much anywhere in the world. And third world countries anywhere, it should be able to get a paper towel, right? But sometimes even paper towels can be a lot. If there's not even a paper towel, of course you can do a shirt, t-shirt, what do they say? You could use sheets, other towels, but you can also use a tissue. A tissue is not as good as a paper towel, but you know what? It works. It definitely works. So again, I'm just going to kind of put it around on my hat there just to kind of hang it on, and then just get the tissue under. Wrap it on both sides, down on my nose a little bit, and on the bottom. You could actually leave it like that, it wouldn't be a big deal. There you go. So again, covering your nose and your mouth is not difficult. You can do it with a tissue like I'm doing here. You can do it with paper towel, right? You can sew yourself a mask. You can do anything you want, but just don't not have your mouth and nose covered. That's the whole thing, right? As far as like the culture aspect of it, I agree it's a little weird. If you're not used to wearing a mask, it's a little weird. But there's two things about wearing a mask that is really, really important. One is that you'll get used to it, right? So So weirdness of covering your mouth and your nose, right? Covering your mouth and nose. So there is a weirdness to it. So there's a cultural thing, cultural norms. If your culture doesn't typically do it, right, it's a pandemic. We are in a global pandemic with a virus that spread through microdroplets. Spread through microdroplets, right? So we're not talking about something forever. We're talking about during the pandemic and afterwards so that we can stop the virus, right? This is not, we don't have to change everything forever. It's going to obviously change our cultures for, years to come, but it doesn't have to be permanent, right? So also, when you do wear a mask, or just cover whatever you want to use, cover your nose or your mouth. It's really not that bad. It's not that bad, right? People look at you once, and then they're like, "Oh yeah, it's a pandemic," right? They're like, "Oh, it's not usual to see masks. Oh, but it's a global pandemic," and they don't care. No one's gonna care. Also, the importance of wearing covering your nose or your mouth is that you yourself are basically supporting the cause. You're saving lives. So every time you go out in public covering your nose and your mouth, even though it feels weird, do it as a symbol of pride because you're saving lives. You're going out there and showing everybody else that it's okay. That it's okay for them to save lives too, and that they can cover their nose and their mouth. And when everybody does it, even when you're walking or doing public places, it just it makes it easier for other people to do it. And when everybody does it, then you get to the point where you are, saving lives and stopping the virus, right? This is very powerful, very, very powerful to do it, but everybody has to do it, right? So we start with one person doing it, and you get two people, you get one business requiring people to who want to shop at their stores, who want to work at their stores to cover their nose and their mouth, then you get a second business, then you get a third business. Eventually, every business who wants to, who wants to go into a business where they're, not safe, where you're going to be where you're 10 to 20 times more likely to get the virus, right? If I could go to grocery store A and grocery store B, and grocery store A is just, doing nothing, and everyone's just walking through the grocery store and buying food, and not wearing a mask, not covering their nose and their mouth. All the employees are, sneezing and coughing over all the food's contaminated. Nobody wants to go to that grocery store. That's disgusting, right? And then grocery store B, right? They just have a policy. They put out a sign at the front of the door saying you're not allowed to enter this store without covering your nose and your mouth, right? If people try to enter without covering their nose and mouth, they ask them to leave, and they tell them the policy, or they give them, a tissue and a rubber band, right? It's not that hard, right? And then that store will be 10 to 20 times safer, right? Store B. I would always want to shop at grocery store B that is 10 to 20 times safer, and that I'm not going to get the virus. I'm protecting myself. I'm protecting my community. I'm protecting my family by going to the grocery store that is creating policies that are saving lives, right? So the bottom line is that it doesn't have to be complicated. It's just basic protecting your business assets, making your customers happy, making sure everybody's lives are safe. I mean, this is not hard. Anyone can do it. Any business can do it. Let's just do it, right? So how do we actually go about doing it? Because the truth of the matter is that just saying to do it isn't enough. We actually have to put pressure, right? So the next part of this is basically for those who do want to help out, we need to have a campaign and really, make sure the businesses do it, right? So we know we want businesses to put out a sign on their front doors telling people to not enter the store without covering their nose and their mouth, right? We want people to cough and sneeze outside, right? And ideally, we would do temperature checks, but that's, secondary, right? So this is not saying you're not going to be washing your hands, you're not going to be doing social distance. You still have to wash your hands, and you still have to social distance, right? We know that, right? But this is basically saying of all the science, the number one thing that we can be adding to our arsenal to combat this virus on the front lines, within the grocery stores, within public places where the virus is continuing to spread on the front lines, in waiting rooms, right? Covering our nose and our mouth is the number one way to do it. It's also the easiest way to slow down and stop the spread of the virus in other countries, in third world countries where they don't have a lot of access to testing. Not that we have enough testing here in the United States either. But again, testing is great to do testing, but it's not as helpful when you're not also tracing and tracking and isolating those who are tested positive. Because if they test positive, you just put them right back in the general population. They still need to eat, and they still need to get food, and they still go outside, right? So if they're not wearing, it makes it so much easier for people who may have the virus or know they have the virus to cover their nose, their mouth when everyone else is doing it, right? If everybody's doing it, it's just so much easier for just to keep everybody safe. Again, we can't afford to wait for our governments to save us. We just have to step in and do it immediately ourselves, right? It's just easy enough. Again, it's not even just any one country. One country may be doing it, but then we can help other countries make it culturally normal during this pandemic to cover your nose and your mouth, right? So that is super important. So we can share this video, we can share the posts, we can let other people know about it. But most importantly, what we need to do is we need a campaign, because we know the number one place this is happening is basically grocery stores, pharmacies, and other in locations where people work, like delivery service and warehouses, right? So businesses are the number one focus. So it's not that difficult. We can just call our local businesses, right? So call local businesses and ask them to make a policy to require everyone entering the store to cover their nose and mouth, or their mouth and nose, right? It's really that simple, right? So how do we coordinate that, right? So we have a link to a spreadsheet which lists most of the businesses. We can add more businesses, and then there's just the contact email, and or some businesses have a contact form. Some businesses are very hard to get in touch with. You might just need to talk to them while you're there and let them know. Primarily, you want to let them know the science. The science is that we can have 10 to 20 times reduction in the spread of the virus if everybody covers their nose and their mouth in public places, right? Like grocery stores. So anyone who wants to can go to our website, stopcoronavirusglobal.org. They can communicate on our Skype groups and our Facebook groups and all that, and we'll also post the information here on this video in the description, right? And so you would just go to the spreadsheet, go to spreadsheet, and then either add a business or contact an existing business, right? We have a cheat sheet that goes over what you would say to them, although we basically covered it all. I mean, you're basically telling the business, look, to protect your workers, to protect your business, to protect your customers, to save lives, to stop the spread of the virus, we need to all be covering our nose and our mouth. It's the best way to do that. If they want to add another step, it's good to also do temperature checks, but at least cover the nose or mouth. It's the easiest thing that we can all do to stop the spread of the virus and get back in our economy going, right? Protecting all frontline workers, not just some of frontline workers, right? So the cheat sheet goes over what to tell them. It has links to some of the articles and the science, so you can email them with the information, or when you do the contact sheet. So if we're all contacting all the businesses, all the food locations who are doing takeout, because you want to buy food. If you're buying food at takeout, you want to buy food where workers aren't talking and breathing and coughing, sneezing all over your food that they're making, right? The cooks and everything, they should be covering their nose and their mouth. How everybody who's on this food wears a little, head bandana thing to cover their hair. It's the same idea. You don't want hair in your food, but you also, with this pandemic, you want to cover your nose or mouth so they're not breathing and coughing and sneezing and talking onto the food. So that's really the number one thing that we can all do. We do not need permissions from our government to call these businesses. The businesses do not need permission from the government to institute policies that protect their own workers, right? And their assets and their food in the store and the customers to keep people alive, right? It's really not necessary to get buy-in from the government. Of course, we would love buy-in from the government, so also call your representatives and government officials and ask them to institute a policy where everyone covers their mouth and nose. Pretty simple. I've called pretty much all my representatives at least 4-5 times during this pandemic so far, and I just keep begging them to do more suppression model, and some things have happened, some things haven't, and I just keep calling them and keep bugging them and telling them that until they're saving all lives, it's not enough to only save some of the lives, right? 100 to 200,000 people dying in the United States, tens of millions of people dying across the world when it's unnecessary. It's just like, let's cover our nose and our mouth and stop some of those deaths. Every time we can stop a death is a good thing. So I believe that's pretty much it on this video. Thank you for watching, and just do everything you can. We have other videos if you need more information on the entire suppression model and setting up quarantine or isolation centers or doing tracing and tracking or any of the other essential scientific methods to stop the virus. Again, we are against the mitigation model that allows millions of people to die, and instead we support the suppression model. It's also the model that's supported by the United Nations Secretary General and the World Health Organization. It's the model that was successfully done in China, in South Korea, in Hong Kong, and other Asian countries, and it is the model that everywhere across the world needs to be doing. We need to be supporting and raising funds. Across the world, I think the UN is trying to raise billions of dollars to support all countries, especially the 50 most at-risk countries that need support to stop the virus. It is not enough to only stop the virus in richer countries. We have to stop it everywhere. So when we talk about Stop Coronavirus Global, we're talking about everywhere. And that, stopping it everywhere will help everybody, no matter what country you're in. So again, stopcoronavirus.global.org. We meet weekly at full moons, new moons, quarter moons. So you can just look up whenever that is. You can go to our Facebook site. You can go to our groups and Skype group, and you can get the links to our conference calls and communicate with us and volunteer, or we are even willing. We're trying to raise funds. We're getting closer to bringing some funds, and hopefully it'll happen soon, and then we can ideally hire some people to do some of this work. It's a lot of work to contact and coordinate and work with the businesses, to work within supporting entire countries where their governments are not actually implementing policies that are saving lives, and instead are implementing policies that are support owners and rich people who want their businesses to be successful. So again, the best thing for the businesses, the best thing for the economy is to stop the virus in its tracks using the suppression model and the even more specific model of stopping the exponential growth and instead doing exponential decline and full stop of the virus. So that's what we're pushing. It's possible, the science shows it, and this first step is cover your mouth, your nose. Let's get that out of the way across the entire world. Done. Thank you for watching.